Um, I work. I worked at Brown Community College with Miss McMahon and Dr. Brennan, and the disease I searched on was xeroderma pigmentosum. So my outline, first I'm going to describe what exactly is xeroderma pigmentosum. Then I'm going to describe the subdivisions, the chromosomes it found on, the symptoms, its stages, the statistics, and the diagnosis, and finally the treatment. So xeroderma pigmentosum is a rare autosomal recessive genetic disorder, and the individuals infected are usually sensitive to ultraviolet light, which is the sun. And the ultraviolet light damages the DNA repair, causing the person to have severe sunburn, even if exposed to a minimal amount of light. Xeroderma pigmentosum can be found on chromosome 2, 3, 6, 9, 11, 13, 16, and 19. So there are 8 subdivisions to the disease. It's xeroderma type A, type B, type C, type D, type E, type F, type G, and the variant types. So these are just pictures of the chromosomes. Chromosome 3, the type it causes is xeroderma type C, and its protein is XPC. Chromosome 9, the type it causes is xeroderma type A, and the protein is XPA. So on chromosome type E, the person will get xeroderma type E, and the protein it affects is DDB2. And on chromosome 19, it causes xeroderma type D, and its protein it mutates is ERCC2. Chromosome 2, it causes XP type B, and protein ERCC3 is affected. And then chromosome 16, the type it will cause is xeroderma type F, and the protein it affects is ERCC2. And again, chromosome 13 type, and it will cause type G of xeroderma pigmentosum. And on chromosome 6, it will cause the variant type of xeroderma pigmentosum, and the protein it will affect is POLH. So on chromosome 3 and 6, it's not really like the others because it doesn't really cause any neurological problems like in the other types. Chromosome 2, 9, 16, and 19, the mutations in the chromosome causes neurological problems such as difficulty walking or swallowing. And on chromosome 2, 6, and 11, mutations on this chromosome can lead to high risk of developing cancer. So the symptoms. It doesn't only affect the skin, but it also affects the brain and the eyes, but it's not really that common. For the skin, the person will get blisters, severe sunburns. They become very sensitive to any light, which is called photosensitivity. They could develop certain types of cancers. They could also get scaling of the skin, and they can get telangiectasia, which is like blood vessels on the surface of the skin, and their pigment changes will change in their skin. And for the eyes, they will get ectropion, which is like the lower eyelid will like flip outward, and that will cause infection of the eye. Certain cancers can develop on the eyelids. Also conjunctivitis, which is the pink eye, and infections, and neurological. The person can become deaf, get mental retardation, and spasticity. And these are just some pictures of scaling, telangiectasia, some pigment changes, conjunctivitis, and ectropion. So Xerodermal pigmentosum can be divided into 3 stages. So the first stage usually begins after 6 months, and it could cause diffuse erythema, which is skin redness or inflammation that is spread over a large body surface, and it will cause scaling and freckles. They will first appear on the face, but eventually moves downward, like around the neck and the legs and maybe the back. These marks usually go away during the wintertime when the sun isn't really around, but eventually they will become permanent. So stage 2, poikilodermia, which is like pigmentary and atrophy changes in the skin. So the skin changes skin color, and atrophy is like basically your skin starts to rot. And then hyperpigmentation is increased production of pigment production and blood vessels changes in the skin. And stage 3, it's usually seen between the ages of 4 and 5, and certain skin cancer can start to form. So melanoma, which is the most severe type of cancer, develops in the cells that produce melanin. Basal cell carcinoma, which is basically not really that severe, and it's a slow-growing cancer, so once it's diagnosed, it's really easy to get rid of. And the statistics. 1 out of 250,000 in the U.S. get it, and also in Europe. It's more common in Japan. It's actually 1 out of 40,000. And then the disease is usually seen between the ages of 1 and 2. Both parents will have to be carriers of the disease for the child to be affected, so it's a recessive disorder. 1 out of 4 of the children will be affected, 1 out of 4 will be unaffected, and then 2 out of 4 will be carriers. So the diagnosis. Doctors will look at any skin or eye abnormalities in the person. They will ask to know whether or not xeroderma pigmentosum is found in the family history. They would also perform eye tests to check for clouding of the cornea or more. During pregnancy, a doctor may perform an amniocentesis test, which removes fluid from the sac to test for abnormalities. Also, blood tests could be performed to check for any problems in the DNA repair process. So treatment. Xeroderma pigmentosum has no cure, so doctors can only give treatments to patients. Patients will have to avoid sunlight and wear any protective clothing, sunscreen, etc. to prevent injury from UV rays. So they're pretty much stay indoors during the day, and they're very, very sensitive to any type of infections. They will also have to have regular checkups with their doctors and regularly check for any cancer development. So cancer is often seen in patients with xeroderma pigmentosum, so they have to be very careful and check for any signs to, in case if it does develop, they could catch it early. And any oral retinols, which is basically pills, will have to be prescribed to help decrease the chance of skin cancer development. And the lifestyle. There are certain limitations, such as patients will have to avoid sunlight, therefore they must stay inside at all times. Patients will have to be precautious about any cancer development and any other abnormalities. Instead of regular windows, they would need to be around special windows with shades to prevent any UV rays from getting inside. And these are my references. And acknowledgements: Dr. Brennan, Ms. McMahon, Bronx Community College, Harlem Children's Society, Dr. Sack. And questions? Yeah, one thing I forgot to add is that any lights that are really high, like really high in frequency, like their watts, has to be, they can also develop like sunburns and stuff, so the watts of the lights have to be really low. or they just can't be around lights at all.
Okay, so I understand stage 1, stage 2, but then you said stage 3, you can either have melanoma or basal cell carcinoma. How would you know, how would the doctor in a sense diagnose whether or not melanoma would form or basal cell carcinoma? Like, what's the difference?
Melanoma is, it appears rapidly, so once it appears, I think once it's diagnosed, it's already probably mid-stage in the cancer, and it's a more severe type, so they could, so they show more severe symptoms of a cancer. And then carcinoma, it's a slow-growing cancer, so there's a chance that it could be stopped, and it's most likely it's diagnosed in the beginning stage, so it's not really that severe as the other one.
I guess what I'm trying to say, because stage 1 and stage 2 is the same for both of them, why is it that they have different outcomes? Like, why is it that one is, like, they have the same 1, 2, 3, but they don't have their A and B, like, they don't have the same outcome?
I guess it's because it's a progressive disease, so it just happens.
What's the life expectancy of this disease?
It's mostly, I would have to say, around 20 years old, somewhere around the 20s. That's it.
So when you were talking about the different chromosomes and exactly what proteins are affected when they were mutated, do you know exactly what mutations were occurring, like whether they were deletions, insertions, or
I
like double
tried
crossing?
looking that up, but I guess I couldn't really find, because it's found on so many chromosomes, and it was really difficult to find the kind of mutation. So no, I don't know.
And also, did they also say what made each, I guess, one different? Like, or did they all have the same characteristics? Or
Yeah, I do
did
have
they, and also, did they arise from different things, or did they arise from the same thing? Like those mutations from those different chromosomes?
If they're on certain chromosomes, yeah, they do have different symptoms. But I think they all arise from the fact that they're genetics. That's about it. It arises from the fact that it's in family history, but nothing environmental or anything else.
And also, I'm just curious, did you also look at, so you said that it was in the previous slide where you also list the protein that was affected, so did you sort of take a look at the specific function of those proteins to see what other things they
All
may have been
those
affecting as
proteins are involved in the DNA repair process. So if any of those are damaged, then the DNA repair process is completely destroyed. So that's why the person can't be in UV rays, because their DNA repair process can't perform right, and it would just the DNA would just build up and cause severe problems to the person. That's it.